I'm Dr. Devin Garza. I've been in practice in Austin, Texas as an OB-GYN for the last 20 years. My special interests include advanced robotic laparoscopic surgery as it applies to the treatment of complex hysterectomies, fibroids, pelvic floor prolapse, pelvic pain, and endometriosis. I regularly teach and instruct other surgeons in these procedures. I also have a referral base for the evaluation and management of urinary incontinence. What is stress incontinence? What is urge incontinence? Stress incontinence is the involuntary leakage of urine with cough, laugh, sneeze, exercise, lifting, jumping, etc. The stress is not an emotional stress, but a physical stress on the bladder. Urge incontinence is the involuntary leakage of urine due to bladder contractions or spasms, which usually present with a strong urge to urinate, the gotta go symptom with the associated dribble or prolonged leak. These episodes of leakage can be precipitated by the same stresses on the bladder I just mentioned, or completely without precipitating factors. Other terms for this are overactive bladder and detrusor instability. What causes urinary incontinence? For stress incontinence, the most common cause is previous vaginal delivery. Some women can have had several children and have no leakage, and others may have had just one single child and be very symptomatic. Other causes may be chronic stress and straining on the pelvic floor due to work or lifestyle, obesity, and quite frankly, simply unknown. For urge incontinence, or the overactive bladder, the mechanism is mostly unclear, but somehow the learned mechanism that allows for what we call potty training ceases to function predictably and effectively, and the reflex signal from the bladder to the spinal cord as the bladder fills and expands is uninterrupted by the brain, allowing the bladder to contract, thus causing leakage. What are the symptoms of incontinence? How is urinary incontinence diagnosed? The symptoms of incontinence are basically any involuntary leakage of urine with or without an urge. Urinary incontinence is diagnosed initially by patient history, meaning the patient simply states she's leaking urine, and her doctor will generally ask specific questions to help narrow down the diagnosis. And testing in the office, called urodynamics, helps clarify between stress incontinence versus overactive bladder, and helps identify those patients who may unfortunately have both. How is incontinence treated? What non-surgery treatments are available for incontinence? Stress incontinence can be initially approached in a highly motivated patient in a non-surgical manner with pelvic floor exercises known as Kegels, weight loss, biofeedback, and certain lifestyle changes which may help. But the majority of women may not want to continue suffering this often embarrassing symptom and opt for surgical repair. Urge incontinence is not treated by surgery at all, but antispasmodic medication is used. What surgery choices are available to treat incontinence? The most common and effective techniques fall under the category of what is called a bladder neck sling. The evolution of this procedure is based on finding an approach to effectively manage the same urinary incontinence, but requiring no need for a large abdominal incision and the associated prolonged recovery. That was previously the gold standard of care. A laparoscopic approach is also now available.